to the call for the basic income guarantee.
Discussion on the motion. All in favor of the motion? Carried unanimously.
So thank you for the opportunity to present on behalf of the Lanark Basic Income Network. I'm Celina. I grew up in Lanark County and I've lived in Perth for the last 3 years. I have degrees in social work and in psychology, and I've worked in the health and fields for many years, more than 20. So through my own lived experience and through my work experience, my professional life, I am familiar with the challenges faced by those of us who live with financial and income precarity and or in poverty. I'm here tonight with my colleague and fellow LBIN volunteer, Tom, and we are 2 of 19 volunteers working through the steering committee, the outreach and the political advocacy committee and LBIN, and we are also part of a larger growing coalition of, I think it's 153 other members and volunteers throughout Lanark County, many of whom reside in Perth and some of whom are here tonight. So before we jump into the presentation, I'll just give a definition of what basic income is. It's an unconditional cash transfer from governments to individuals that should enable everyone to meet their basic human needs, to participate in social life and society, and to live with dignity. So it's an income floor to reduce the risk of people slipping into poverty by unexpected events in their lives, life transitions through the course of living, and challenges that we face in these very trying times. Next slide, please. So this is the income tested basic income. It's a model that is supported by a majority of advocates for basic income in Canada. And as you can see on the left, so in the absence of any other source of income, an individual would receive the full amount of basic income. However, as other sources of income increase, the basic income decreases and is eventually phased out. Next slide, please. I'm just going to say next instead of next slide, please. Okay, so basic income programs do already exist in Canada. For example, the Canada Child Benefit is available to families and caregivers of children who are children and youth 17 years and younger. And then we have the guaranteed income supplement for seniors 65 and over. So these are long established working basic income programs that where money is distributed to eligible people regularly and with their requirement for work and absent other income, these sources of funds will help to meet basic needs. So we propose something similar for individuals between the ages of 18 and 64. A basic income guarantee to help eliminate or reduce the risk of people sliding into poverty because of the precarity of work situations and difficult life experiences and challenges. Next, please. So the first benefit of basic income is financial stability and flexibility, because almost everyone is vulnerable. We are, I'm sure most people in this room have experienced or know someone who's experienced one or more of these situations. And these are not uncommon events, but they make our lives unpredictable. And that unpredictability has tremendous wear on individuals, on families, on households, on our communities, and on society as a whole.
I'm saying check quickly. This precarity of income, it's not going to be restricted to any particular class as it exists today. There are changes happening in the workforce across the developed world that are going to affect job creation and job persistence across all workforces, with the introduction of AI, for example, which is affecting people in the high income brackets as well. So it's a real thing. I'm of the opinion that it's only going to get worse with the development of these new technologies. And then of course we have the example of the pandemic and the use of the CERB, which was a form of basic income helping through.
Next slide, please. Next. The second benefit of basic income is improved physical and mental health, and a reduced demand on the public health system. So there's a powerful correlation between income and health outcomes. So for at each rung of the income ladder, Canadians have less sickness, they have longer life expectancies, and they have improved health overall. And that is from the Government of Canada's Social Determinants of Health and Health Inequalities website. Earlier this year, the Hamilton Spectator reported on the increasing health disparities between have and have-not neighborhoods in Hamilton. The Mincome Manitoba Basic Income Project from the 70s, that data was analyzed recently, and researchers reported a decrease in hospital visits related to mental health issues, lower rates of domestic violence, lower rates of work-related injuries, farm and motor vehicle accidents. And the some of the data from Ontario's basic income pilot, which was shut down when the Ford government came in, they received some of the data and analyzed it and found that again, there were improved mental and physical health outcomes, and for participants, but also for people in the houses of participants, and again, a reduced medical system. And I say they got part of the data because the province hasn't released all of the data, so the researchers worked with that. And they were from McMaster and Ryerson universities. Next. So our own health unit has acknowledged the linkages between income and poor health outcomes. So lower income households report poor physical and mental health. They have a weak sense of community belonging. They do not have regular access to a doctor. They do not have dental insurance. They are much more likely to experience food insecurity, and more likely to have a diagnosis of one or more disorders, such as anxiety, asthma, diabetes, high blood pressure, heart disease, and diabetes and immune disorder. They are more likely to smoke, and they are more likely to be physically inactive. Next. So the third benefit of basic income, it stimulates local economies. So people have more money to spend, demand for goods and services increases. Existing businesses are more likely to prosper, new ventures are more likely to open, and the availability of jobs are more likely to increase. Basic income moves very quickly through the economy. Next. So this graphic is, it draws on the Canadian Centre for Economic Analysis report, that's CANCEA. They did an analysis of the benefits of the Canada Child Benefits on the Canadian economy. And they found that for every dollar dispersed through the program, $1.97 was contributed to the GDP. Meaning that the economic activity generated by the program is almost more than double than the benefits dispersed. Next. So support for basic income is growing. It's been around for a long time, but particularly since the pandemic and a lot of the changes that reaped upon our societies. So we have long existing, well-established basic income programs. 6 of 10 Canadians have indicated that they would support a basic income program for low-income households. We have bills before Parliament right now, one in the House and one in the Senate. Both are asking for a national framework for the basic income. There are existing basic income programs in Newfoundland and Labrador and in Quebec. There's a very credible proposal for a basic income project in PEI for working age adults. There is all party support for that project. And this year, the federal government indicated it's willing to explore the project with PEI. And of course, there are many municipal resolutions in support of the concept of the basic income. Our chair, the LBIN chair, and the Reeve of Tea Valley Township, who is, oh my gosh, Rob Rayner, who many of you know. So Rob is making a presentation tonight to that committee of the whole. And I'm hopeful that with this presentation and that presentation, we will have 2 more councils supporting the concept of basic income. Next. And this is our ask of the Perth Town Council, that the town express support for the concept of the basic income and call upon the federal, provincial, and territorial governments to collaborate on the design, introduction, implementation, and ongoing evaluation of a national basic income guarantee for working age adults. So all that to say thank you very much. Thank you very much for the opportunity to present.
Okay, Councillor Gold.
Thank you, Mr. Chair. So my question for you, Celina, is through your whole presentation, and thank you for that. There's never been any mention as to what the annualized amount of income you feel is necessary for this whole perform of the work. What is the dollar amount per year, or do you even have a dollar amount yet that is been determined to say this is the level I need to be at in order to achieve the goals of your presentation?
I do not have that information, but greater minds than I have worked on it for a very long time. Oh, I'm sorry. So other people have been working on this for a long time. I brought some reports for people to read who are looking for detailed information, and the amounts vary depending on the projects. And I think that it's important to recognize that we are requesting too that governments look into this. There are a lot of anti-poverty organizations and social policy researchers and people of the general public, health advocates, who are and politicians, conservative, NDP, green across the spectrum, political spectrum, who are looking into this. I'm sorry, I do not have that information to provide to you tonight.
If I could just add, I believe that the Prince Edward Island proposal has had one of the best economic analysis that I'm aware of in our country. My recollection, don't quote me, but I believe they were talking in the range from $7,000 to $30,000. But that is in their proposal. How that will finally cascade down is going to depend on time. Thank you.
Councillor Waterfield.
Through you, Chair, I want to thank you for a very informative presentation. I'm a strong supporter of basic income. I applaud and I support your efforts.
Okay, Mayor Brennan.
Yes, I know it's been found that within the justice system, if there's a community justice program, that in effect brings societal costs down because, kid doesn't end up going to jail and, remedial efforts. Have you found a similar thing with, the basic income?
I cannot speak to that. I am not aware of that particular kind of research, but certainly in other research I have done, the stress of financial precarity, it increases family violence, it increases stress in families. I do have personal experience of someone who has committed suicide because of his business failed. But
Yeah, not a suicide note, but in terms of reduction of costs, the Stanford Basic Income Lab in Stanford University has a fabulous reputation, as you know, has recently, I think it was 2021, their review came out and showed that not only was poverty alleviated to a considerable, but there was the greater enrollment in educational processes and a decrease in the number of visits to emergency departments and health and that type of thing. But it's not well quantified. That's the problem. And in their review, they looked at studies that were done across the world. So a lot of their data isn't just in North America, it's also in third world countries. And that's why it's so important that our government develop a framework and a discussion. I don't think anybody has got it figured out in their head right now exactly how this is going to roll out if it ever comes to fruition. But there's enough data out there to suggest how important it is, and that we need to at least begin to discuss how the framework would roll out and where the savings can be made if indeed they're there.
can I share with you a quick quote from the Stanford Basic Income Lab, their report? The evidence from diverse interventions in low, middle, and high income contexts indicates minimal impact on aggregate measures of labor market participation, with some studies reporting an increase in work participation. When reductions do occur, time is channeled into other valueless activities, such as caregiving. And that's from their 2021 report, a copy of which I can get.
Sure, final comment, we're going to turn the floor to Councilor Craig.
My parents raised their three oldest children during the Great Depression, and I could tell you stories about what it was like, but it was said that it didn't really bother the kids that much because everybody was the same. But you've got, a far different situation here where people with a great deal of money and people with virtually none, and that wouldn't be expressed.
Okay, Councilor Craig, you
To you,
have
Chair.
one final comment, Councilor Smith.
I just want to thank you for your next presentation. I fully support the work you're doing, and I also support basic income.
I'll just let Councilor Burns have his comment because I'll turn the floor to Councilor Craig.
Thank you, through the chair. I was going to ask a number of questions about the mechanics of this and how it would operate, but I brought myself back to what you're actually addressing with this. It's quite clear from what you're saying, it's the concept and principle. I was going to ask questions about, is it residents, is it citizens, is it nationally, as you said, or is it provincially, as the examples have been given? But I'll wait. It's concepts, so I'm happy to follow and support that.
I'm happy to try and answer some.
No, it's all right. You support this.
Okay, so I'll end that portion of questions for the delegation. I'm going to turn the floor over to Councilor Craig.
Thank you, Chair. So I have two questions. First of all, if you could talk a little bit about Ontario Works and Ontario Disability Support Program and how this program will enhance those pots of money.
I'm sure enhances the rate. Ontario Works, for example, if you're looking for resources to support basic income, Ontario Works would cover this. Quite frankly. As with several other programs. In terms of the disability benefits, that would probably enhance them, because the disability benefits that are currently being paid are so far below any level that people with disabilities can support themselves on. It would probably enhance their ability to participate in society more fully. But I don't see, I haven't read anything, as you have, where we've talked about any change to the disability programs as they currently exist, but.
Well, they're deeply insufficient, we know that,
Exactly.
and they don't meet the basic needs. So that's the first one.
In some, a basic income policy would, of course, it would interact with, the programs. And some of which would be, streamlined, as they're doing in PER, in Newfoundland and Labrador. And others would disappear, and others would be extended or enhanced. But that is why we're looking, for, an examination of the basic income by governments. Sorry, go ahead.
And my second question is, well, first of all, I'm totally in support of basic income concept. And in fact, I will be bringing forward a motion here shortly. But I know there will be people in the community who will say, because I've heard this, and they say, you know, if we give a basic income, then some of these folks will not have an incentive to go out and get a job. So how do you, what's your thought on that?
There is no evidence that I'm aware of, proving that a basic income is a disincentive to work. A lot of the research shows that people tended to work more because they were able to improve their financial status by working and not having clawbacks. Like, this is a guaranteed basic income. And the research suggests that where people did leave work, it was to care for others, to raise their children, to pursue an education, or they left a low-paying job and moved on to a better job with better prospects, better pay, and chance to move ahead.
So in other words, it provided them with more options.
Yes, very succinct. Thank you.
So can I bring forward?
You sure certainly can.
Okay. As recommended by the Committee of the Whole, be it resolved that the Council of the Town of Perth hereby, number one, receive for information the delegation from Dr. Tom Todd and Celina Tuttle, Lanark Basic Income Network, as presented at the Committee of the Whole meeting on June 4th, 2024. Number two, adds its municipal vote to the call for the basic income guarantee for work-age adults in Canada, which would help to combat low income and economic vulnerability within our community. Number three, calls upon the federal, provincial, and territorial government to collaborate on the design, introduction, implementation, and ongoing evaluation of the National Basic Income Guarantee Program for working-age adults. And number four, directs the Council support and request for action be forwarded to the Prime Minister, the Premier of Ontario, the local MP and MPP, applicable federal and provincial ministers, the Federation of Canadian Municipalities, FCM, the Associate of Municipalities of Ontario, AMO, the Rural Ontario Municipal Association, ROMA, and Eastern Ontario Wardens Caucus, EOWC, and Lanark County municipalities.
Discussion on the motion. All in favor of the motion? Carried unanimously. Thank you very much for your presentation.
Thanks very much.